we are entering into a crucial phase from the co-creation to the co-implementation, and we need every one of you. Because it's true is that the objective of the mission is to build a pan-European innovation ecosystem to beat cancer through innovation by bringing together member states and regions, different sectors and disciplines, investors, citizens, including cancer patients and their caregivers, to create real and long-lasting impact. Don't be surprised. I mention immediately the keyword in innovation, because today, as Commissioner responsible not only for the mission on cancer, but for innovation too, I will try to make a link between the new wave of innovation and how that can be beneficial for the implementation of the mission on cancer.
So if we now make a case example that, let's say I'm a patient now, right, I could use a medication management solution, and that would be the first app, right? And if I then don't feel so well today, then I would go into the symptom checker app that I also have on my phone and then check what might be wrong. And if then that symptom checker app says that I might want to speak with the doctor, then I can use my e-booking app, which is again a different app today, to then book an appointment. And that appointment can then be a teleconsultation or in person. And teleconsultation would then, in many cases, yet be another app that I would then have to install on my phone. And then finally, the online pharmacy would then, in many cases, be another app, right? And today, most of those apps come from different companies, and they are not necessarily speaking with each other.
We do have a fragmented health system divided in 21 regions. So I think with the European health data space, it might be easier or quicker to share data between the countries than within our country. We're actually joking a little bit about that. So that's one of the upcoming, of course, priorities then for the Swedish presidency. So that I can tell that just with the data and the data space is one of the priorities for us.
Even though cancer is primarily national competence, we are doing a lot on European level. We have created the Europe's Beating Cancer Plan, the parliamentary report. We have concrete initiatives that we are working on. I think the most important one is the health data space regulation. I think there is a real good chance, there is a real good opportunity for this to be adopted. Of course, we will need your help. We will need help from the stakeholders to put the pressure also on your national governments, because member states are usually the ones who are blocking things in the area of healthcare on European level, because they always say this should not be European competence but the national competence. So when you get to the point of negotiating with the Council, I hope that you will also put the pressure on national governments not to block this, because I think this is very important.